morning, good afternoon, good evening, everyone. Nasa man po kayo sa mundo. Welcome to the 59th installment of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. We are glad that you can join us today as we continue on with our 5th season of our COVID-19 learning journey together. So commonly, when people talk about vulnerable sector society, usually they refer po to the senior citizens, pregnant women, mga indigent population po, no? But we wanted to put a focus today on the topic really on a sector really close to our hearts, and that's COVID-19 and how it has been affecting our children po. So maraming salamat po sa inyong pagsubaybay at pagdalo po dito po sa ating webinar number 59. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. It's always a pleasure to be with all of you during our regular Friday lunch date, and always look forward to our Fridays because I get to share my hosting duties with my partner in crime and my mentor, also our adjunct research faculty at the National Telehealth Center, and really one of the internationally renowned public health communications expert. She's none other than Dr. Susie Pineda Mercado. Dr. Susie?
Uy, thank you, Raymond. Kamusta ka na? Good afternoon. Magandang hapon po sa inyong lahat. Good afternoon to everyone who's watching from all around the country and from other parts of the world. I can see that there are people we have people watching from Fiji, and Raymond's going to tell us where the others are watching from, but to our Metro Manila hospitals that are watching, to all of our regulars. Also, babatiin natin yung mga nanonood from the Department of Education because your Undersecretary, Yusek Dads, is here with us today. We're going to talk about children and COVID. And I think we all have a lot of questions, a lot of things that we want to know as the pandemic is not yet really over. And we are really honored and privileged that this webinar today is co-hosted, co-sponsored by the Philippine Pediatric Society. So binabati po natin lahat ng mga pediatrician na nanonood from all over the country. Welcome po. And I think we're all here to take care of our children, to make sure that everyone's safe and to learn. There's so much to learn. So it's a Friday, and I hope you will enjoy this session today. Over to you, Raymond.
Thank you, Dr. Susie. And as mentioned po, no, very, very important topic for today. And that's why we have invited, really, they are co-sponsoring this webinar, the Philippine Pediatric Society, and also representatives from its regional chapters po, no. We want to take a closer look on the Philippine data, specifically in COVID-19 and children, yung pong risk, symptoms, and management. And as mentioned po, and for those who have seen our poster, we have also invited someone from the Department of Education, kasi alam po namin na yung pong mga katanungan really will be kailan po ba babalik ang mga bata sa eskwelahan. But so please join us today for this very important informative session. We will sift through all of the data, paano po ba ang pagkaka-infect ng mga bata kumpara sa mga matatanda, what's the epidemiology behind it, yung symptoms po ba nila lumalala katulad nung sa mga matatanda, or primarily ba mild ang kanilang mga symptoms or asymptomatic. But for those who are joining us for the very first time, ang structure po ng ating webinar, meron po tayong main discussant or presenter, and then also a set of reactors po, no? That's how we have been doing it. Really, a lot of our discussion, the rich discussion will be during the panel discussion po. So we hope that you'll be able to join us up until the end of our webinar. And before we continue on, I think there are Mentimeter instructions from Dr. Susie, especially for those who are joining us outside of Zoom.
Okay, so as you know, you can watch through Zoom, but you can also watch through Facebook and YouTube. And for our audience who are watching us on Facebook and YouTube, when we have our little opinion poll or our fun quiz, you can participate. If you're not in the Zoom call, you can participate by going to www.menti.com and use the code 59641081. So that's on your screen. Let's take a look at it again. 59641081. So we will give the question later. Now, for those of you who are on Zoom, you're just going to go into the opinion poll. Okay, over to you, Raymond.
Thank you, Dr. Susie. Ulitin ko lang din po, lagay po ng mga nakaraang mga webinar, yung pong mga katanungan sa ating Mentimeter sa www.menti.com. Yun din po ang very same questions na nakikita po of those attendees po na nandito po sa ating Zoom webinar. But before we continue on, I would like to take this opportunity para pasalamatan po ang napakasipag at masino po na miyembro ng ating webinar series team. Maraming salamat po to each and every one of you. And really, we endeavor each and every week to bring you quality content and something that's valuable, especially in terms of clinical and public health management of COVID-19 cases. Tapusin ko lang po, also for those who are asking kung ano po ang itsura ng mga certificates, kasi looks like there are still those na very first time na uma-attend po sa ating webinar. But for those who are asking po ano po bang itsura, especially for those who have not seen or receive a certificate of attendance, ito po ang really a copy of the image that you will be receiving for certificates of attendance, and only those who have spent at least 50% of the webinar duration will be given this certificate along with a copy or copies of the presentations po of our resource speakers. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. And at this point, we'd like to go to a very special guest who's going to give our introductory remarks. And as I mentioned earlier, we are very fortunate and honored and privileged that Philippine Pediatric Society is with us in full force. I know we are all concerned about our children during the pandemic, and it's great to have the president of the Philippine Pediatric Society, Dr. Joselyn Eusebio, very lovely doctora who is going to give the opening remarks. Ma'am, go ahead. Doctora, go ahead.
Thank you so much, Dr. Susie Mercado. Good day to everyone. The COVID-19 phenomenon has undoubtedly changed the world upside down. It has transformed our daily existence into an experience we never thought we will encounter in this lifetime. This pandemic has brought us in the world of what we probably enjoyed watching in sci-fi thrillers that kept us at the edge of our seats. Yes, this unprecedented situation has indeed kept us at the edge of everything. The healthcare system is always constantly threatened by collapse. The economy has suffered setbacks in proportions comparable to a recession. The workplace has shifted from outside to inside people's homes. Classes have moved from mainstream to online. Human relations transform from physical to virtual. As we find balance in this new normal, we look at our children and wonder how they coped up with everything that has transpired for over a year now. Aside from our fear that they may contract the disease, we must also manage our deep concerns about how they have adapted so far and seal our worries with fervent prayers that this too shall pass and that better days are destined ahead. The Philippine Pediatric Society has continuously collaborated with other professional medical organizations in our collective goal of surviving this pandemic with a new mindset that focuses on resilience, agility, and self-sustainability. The Philippine Pediatric Society has for the past year contributed guidelines, policy statements, educational webinars, data registries, and scientific expertise in the field of pediatric medicine in any and every opportunity it can. The Philippine Pediatric Society, through its recognized subspecialty pediatric associations, have made themselves ready and available resources and references for COVID-19 related infectious, immunologic, cardiac, metabolic, behavioral, and neonatal concerns, providing timely and accurate information to help the general public. Likewise, the PPS has generously shared its rich bands of experts to serve as advisors, policymakers, and decision shapers in government-initiated pandemic response institutions like the IATF, NITAG, and NIP. Allow me to thank the University of the Philippines for recognizing the role of the Philippine Pediatric Society in this continuing saga as it becomes part of yet another innovative webinar on COVID-19 in children. In behalf of the more than 6,000 strong Philippine Pediatric Society members, allow me to reiterate our commitment to be at the forefront of promoting, protecting, and preserving the best interest of the Filipino child before, during, and beyond this pandemic. Thank you and good day.
Hey, thank you very much. That's Dr. Joselyn Eusebio, the President of the Philippine Pediatric Society. And Doctora, join us later for the panel discussion. We really appreciated your talking about not just COVID and children, but really what is the effect of the pandemic on the well-being of all of our children. No? Anyway, we have a little surprise for the audience later. We actually have two young people who are joining us, and Doctora, join us later for our panel discussion. All right, so Raymond, over to you for our fun quiz. Go ahead.
Thank you, Dr. Susie, and thank you also to Philippine Pediatric Society President, Dr. Eusebio, for that wonderful opening remarks. We are seeing on the screen, especially for those attending po, numbering a little over 1,000 attendees dito po sa ating Zoom. Two questions dito po sa ating Zoom polls, and they are the same that are being seen here dito po sa ating Mentimeter. So for those, again, ulitin lang po, no? For those who want to participate, please go to www.menti.com and enter the code 5964-1081. That's 5964-1081. For the two questions, question number one, ano po ang most common presentation ng COVID-19 in children? Medyo halo-halo po ang mga kasagutan. Meron pong fever and cough. But the options are fever, cough, itchy throat, body aches, headaches, loss of smell, and fever and cough. For our next question, ano po ba ang first line of management for mild COVID-19? Medyo, ayun, as we are trying to get more of our attendees to join in and participate dito po sa ating fun opinion poll, I'd like to take this opportunity also to greet those who are attending all the way from Basco Provincial Health Office in Basco, Batanes, from the Commission on Population and Development Region 3, San Fernando, Pampanga, Newborn Screening Center in Southern Luzon in Tanawan, Batangas, the Child Neurology Society of the Philippines. Maraming salamat po. Dr. Pablo O. Torre Memorial Hospital in Bacolod City, Leyte Provincial Hospital, Palolite, and Zamboanga City Medical Center in Zamboanga Peninsula. Internationally, we also have those very first attendee po natin ito, no? Ural Federal University from Yekaterinburg, I hope I pronounced that correctly, in Russia. The University of Fiji in Lautoka, Fiji, Lautoka Hospital, also in Fiji. Neptune City in New Jersey, Doha, Qatar, Al-Khobar, Saudi Arabia, Niagara Falls, and Geneva, Switzerland. Okay, so what is the first line of management? At least dito po sa ating Zoom poll, and also para na rin po sa ating Mentimeter, medyo konti nga lang po sumagot sa Mentimeter natin. The options are hydration, enough rest, paracetamol, nutritious diet, consult your pediatrician, all of the above. Sundo po sila na all of the above ang kasagutan po. Also, for those who are asking, we have already distributed certificates for all previous 58 episodes. Please let us know if you have not received any, and you can play it back again, rewind it, watch it again po sa YouTube channel ng TVUP for all 58 episodes. And then after this episode, we will also be putting it there to archive. as well as the Facebook pages of TVUP, the University of Philippines, and Stop COVID Deaths. Over to you, Dr. Susie.
Thank you very much for that, Raymond. And I think right now what we're going to do is we're going to watch some opinions from persons on the street that have been interviewed by TVUP. Please take it away.
I think they can get COVID-19 kasi this is based from my personal experience wherein my niece got infected by the virus po. She is 7 years old.
Palagi ko talaga pwede po sila magkakaroon ng COVID. Hindi naman natin kasi masabi na lahat yan nandito sa loob ng bahay. May mga bata kasing nasigilan po sila sa labas.
Sa tingin ko, lahat ng mga bata pwedeng tamaan ng COVID-19. Kasi tayong mga malalaki na, di ba? Hindi tayo accepted eh.
I think children are also at risk in being infected with COVID-19.
Personally, takot ako sa COVID-19, lalo-lalo na sa mga anak ko.
I am sure that with the kind of immune system that children has, they haven't built that kind of immune system that adult people have. So it will be harder for them. There will be a greater impact when it comes to their health.
Bilang nanay po kasi, it is beyond my control po kasi if whether mai-infect yung anak ko or hindi kasi ako yung lumalabas eh.
Isa na rin po, kung ano po yung pinapractice natin na pag-iingat, kailangan sasabihin din natin sa mga bata. Yun din sinasabi ko sa mga bata na kailangan sumunod din kayo.
Hanggat wala po silang vaccine eh, parang nakukulangan po ako na wala akong peace of mind kung mahahawaan sila or magkakaroon ng COVID.
Have to make sure na sila ay full vaccinated. So in my case, I made sure na sila ay merong pneumonia vaccine and flu vaccine. And talagang proper diet.
Extra doses of vitamin C. If they were taking it once a day before, they would normally take it now twice a day.
Feeling ko this time nagiging helpful yung pagiging paranoid eh. Pag paranoid ka kasi, feeling ko mas extra careful ka. Di ba alam natin masama maging paranoid, pero in this case, kailangan paranoid tayo. So, just to be extra careful.
Learning should be kept virtually. I mean, face-to-face classes is more effective, but right now, with the situation that we have, I don't think that it's a risk that we should take.
Okay din po yung online, pero mas prefer ko dito po, basta yung face-to-face, sana, mas madali matuto eh. Ang bata sa face-to-face. Ang problema lang, kailangan patupad yung protocol talaga.
Itong tinatawag nating new normal method of learning, medyo nahihirapan kami dyan eh. Especially ako, kasi kami ng husband ko, hindi talaga namin sinanay yung mga bata sa mga gadgets. Sa 4 kasi silang nag-aaral. So, lagi nilang iniinda sa akin, "Mami, sakit ang ulo ko." Siyempre, di ba, alam naman natin na masama yung nakatutok lagi sa tablet.
Yun ang naging sa amin, naging pagbabago sa amin when it comes to education. So, yung 2 kids ko po, in-homeschool ko po sila. Ang sabi ko nga, after the pandemic, gusto ko tuloy-tuloy na mag-homeschool na lang kami forever. Mas okay siya para sa amin. Mas maraming, mas nagkaroon ng time ako sa anak ko to know him more. Mas nakapag-focus kami sa mga bagay na hindi nakafocus ng isang traditional school.
There would be a vaccine for children. I would certainly give my child a vaccine.
If ever naman po na meron namang vaccination na para sa mga bata, willing naman po kami na pabakunahan yung aming mga anak para mas ligtas sila na makalabas ng bahay at makapag-aral face-to-face.
Ako po, believer po ako ng vaccine eh. So, kung ito naman ay dumaan sa tamang pag-aaral, then why not? Dumating ang panahon na meron ng vaccine ready and ready for children, ako talaga, I will support 100%.
Tulad ng sinasabi ko dito sa bahay namin, sa mga anak ko, sabi ko sa kanila, ingatan mo yung sarili mo. Kasi sa pag-iingat mo sa sarili mo, iniingatan mo na rin yung buong pamilya mo.
Okay, thank you very much, TVUP, for that very interesting person on the street collation. I think it always helps us to have a little context, get the pulse, and try to understand what people are thinking about COVID and children. So we go to our main presenter today, and I think early in the pandemic, we were already seeing cases of what's called multisystem inflammatory syndrome in children, or MIS-C. Now we've seen recent reports from India that there are more children who are getting COVID, and we're also hearing about children who are long haulers. We'll be hearing about Philippine data on COVID-19, and we do actually have two young people who will be with us on the panel today. But our main presenter is one of our leading pediatricians in the country. She has been with us before, so she's very familiar to you. She is also the Associate Dean for the faculty and students at the UP College of Medicine. It is my honor and privilege to welcome Dr. Maria Liza Antoinette Gonzales, or Chet. Chet, welcome back to the webinar.
Hello, good afternoon, Doc Susie, Doc Raymond, and good afternoon, of course, to all the viewers of this Stop COVID Deaths webinar.
Okay, so Chet, please go ahead with your presentation.
Okay, so just allow me to share my screen. Can you now see it, Doc Susie?
Yep, very clear. Go ahead, please. Let's go to PowerPoint or presentation.
So the top,
or at the bottom, there's a little icon there, or you can go to slideshow.
Is it? Sorry. Is it okay? Is it already in slideshow?
Now,
Yes,
now
just
it is. Go. Okay na,
Okay.
Chet. Go ahead.
Okay. So the topic given to me is COVID-19 in children, and I actually have no conflict of interest in relation to this present topic, although for COVID-19 vaccines and NAFIC. For this afternoon, I'm focusing on vaccines. Of course, we may touch on that a little bit later. The first presentation to present the epidemiology of COVID-19 among Filipino children, discuss the COVID-19 registry data, discuss the risk factors for COVID-19, and management and outcome of children with COVID-19. So as of June 30, 2021, there were 182 million cases of COVID-19 worldwide, 3.95 million deaths, and a case fatality rate of 2.17%. In the Philippines, as of June 30, 2021, we had a total of 1.4 million COVID-19 cases, of which 48,649 are active cases. Among the active cases, approximately 95% are asymptomatic or have mild disease, 1.56% have moderate COVID-19, and 3.5% would have critical or severe COVID-19. The death rate is reported at 1.75%. Among those who tested positive, 142,663, or approximately 10%, are below the age of 20 years old, and 6% are less than 15 years old. So this is consistent with reports from other countries with regards to the cases of COVID-19 in children. And consistent also with global reports, the death rates are low in the younger age groups and increase with increasing age, particularly in the elderly, 60 years and older. Our current knowledge about SARS-CoV-2 transmission has been updated. So we now know that there are three principal modes by which people are infected with SARS-CoV-2. The first is inhalation of very fine respiratory droplets and aerosol particles less than 5 micrometers, deposition of respiratory droplets and particles on exposed mucous membranes of the mouth, nose, and eyes, and touching mucous membranes with soiled hands contaminated with respiratory fluids containing the virus. Now, the CDC maintains that COVID-19 most commonly spreads through close contact within and infected people with respiratory droplets. Children with COVID-19 are more likely than adults to have upper respiratory tract involvement and nasopharyngeal carriage with higher SARS viral loads at presentation. However, children are unlikely to be the major source of transmission in the community. Family clusters of confirmed COVID-19 cases showed a greater number of adult index cases who develop symptoms first before any other household contact, including children. So contrary to earlier assumptions, children are not a major source of COVID-19, and they are more likely to contract the disease from close contact with infected adults than from other children. So children comprise 1 to 10% of the diagnosed COVID-19 cases across countries. However, due to lack of more systematic testing of children, including children with mild symptoms as part of contact tracing or seroprevalence studies, the true burden of pediatric SARS-CoV-2 infection remains unclear. And it's very likely that we are missing many cases of mild or asymptomatic children. Several systematic reviews of pediatric COVID-19 have described the disease to be milder in children with better outcomes compared to adults. However, a small percentage of children may require hospitalization, develop severe or critical disease, and require ICU admission due to underlying comorbidities. Several studies have reported that children with underlying medical conditions are more likely to develop severe illness and of dying following infection with COVID-19. Most common disease reported in children COVID-19 include cardiovascular disease, which includes congenital heart disease, neurological conditions, chronic lung disease, including asthma, children who have a history of medical complexity due to neurologic impairment, developmental delays, or genetic syndromes, including trisomy 21, may be at increased risk for severe disease. Other underlying conditions are hematologic, metabolic, or endocrine disorders, obesity, and prematurity. COVID-19 is a respiratory tract disease presenting with a range of clinical manifestations. Most children will develop mild or non-specific respiratory symptoms and will not require any specific therapy, can be managed with supportive care alone. Approximately 40 to 60% will develop moderate disease that requires hospitalization and oxygen support, and approximately 10% will develop severe and critical manifestations. Critical disease are those complicated by the acute respiratory distress syndrome, sepsis and septic shock, multi-organ failure, including acute kidney injury and cardiac injury. Noteworthy also is that approximately 15 to 30% of COVID develop
I think we're losing you, Chet. Chet, we're losing you a bit. You're a bit choppy.
Oh, can you hear me now?
Yeah, now it's good. We lost you for like 20 seconds. So go ahead.
So, inflammatory multisystem syndrome, known as the multisystem inflammatory, with an estimated incidence of 2 per 100,000, but it may increase severe inflammatory syndrome with Kawasaki disease-like feature with correct recent infection with SARS-CoV-2. They tend to occur in older children. Now, there are several reasons for this syndrome, but while slightly different, They all include the presence of fever, elevated inflammatory markers, and manifestations of effect on one or of more than one organ system. Several theories have been formulated to explain the adults. This includes expression in the respiratory tract of the ACE2 or angiotensin converting enzyme receptor for SARS-CoV-2, viral interference, and pre-existing cross-reactive antibodies from previous respiratory infections, a vigorous early mucosal immune response, and active innate system of the thymus and circulating naive. Sorry, can you see my slides now?
Not yet, ma'am. There we go. Okay.
Okay. So as I was mentioning, there are several theories on why there is decreased severity and susceptibility.
Okay, Chet, we're losing you. I suggest that you you can't turn off your video, no? Because if you do, we won't see the slides. Pwede ba yan, Raymond? Remove the video. Turn off the video but still share
yes.
slide.
We'll try to turn off her video po, but she can still share her screen. So that should not be a problem.
Chet, try to turn off lang your stop video lang. Kasi it's choppy eh. We're picking up only parts of the... Okay, please try. Okay, nawala si Chet.
Okay.
Okay, let me stop my video. Is it okay?
Yes, ma'am. Go ahead and share your screen again, ma'am.
Okay,
share screen. Yan. Okay, got it. You got it.
Okay. So, as I was saying, there are several theories to explain the difference in severity and susceptibility of children compared to adults. And these include reduced expression of the ACE2 in the respiratory tract, viral interference, and pre-existing cross-reactive antibodies from respiratory infections, a vigorous early mucosal immune response and active innate immune system, the presence of the thymus and higher circulating T cells and adaptive immune system in children, and the absence of age-related comorbidities such as hypertension and diabetes, as well as lower levels of various pro-inflammatory cytokines. Now, the lower level and immature development of these ACE2 receptors expressed in the nasal mucosa of children may explain also the differences in some clinical presentations, such as a lower incidence of olfactory dysfunction, such as ageusia and anosmia. So if present, these are more common actually in adolescents. No? So a recent review, which to date is the largest in terms of published studies on pediatric COVID-19, included more than 9,300 children enrolled in 129 studies. And the findings were consistent with previous reviews that identify the predominance of infection in school-age children with slight male predominance and low hospitalization and low mortality rates. Comorbidities were reported in approximately 30% of cases, with immunosuppression and lung disease as the most common comorbidities reported. The most common presenting symptoms from the various studies were fever and cough, followed by nausea or vomiting and diarrhea. The other symptoms included dyspnea, nasal symptoms, rashes, Kawasaki-like symptoms, conjunctivitis, fatigue, abdominal pain, and neurological symptoms. 13% were asymptomatic, and they presented primarily through exposure in family clusters or household contact. Out of 3,670 children with radiologic findings, 44% had radiological abnormalities, with ground glass opacities reported as the most common abnormality. For the laboratory markers, pooled analysis of the studies that provided details revealed increased CRP, serum ferritin, lactate dehydrogenase as the most common abnormalities. Other reported abnormalities included elevated ESR, lymphopenia, procalcitonin, treatment of COVID-19 in children is largely supportive. Patients with mild to moderate symptoms can be managed at home with isolation, while patients having severe symptoms require hospitalization and intensive care. Oxygen supplementation may be given, and mechanical ventilation may be required in some patients. In addition to standard supportive therapy, commonly used therapy among hospitalized children included antimicrobials, intravenous immunoglobulin, and systemic steroids. Other treatment regimens included aspirin, inotropic drugs, inhaled interferon, antimalarials, and antivirals such as remdesivir, oseltamivir, and lopinavir-ritonavir. Now, none of these drugs have been demonstrated to improve outcome and have no clear recommendations for the treatment of COVID-19 in children because of insufficient evidence. Hence, they are only given if the benefits outweigh the risks. For hospital outcomes, about 1 in 4 children were admitted to the ICUs. A high proportion of children with severe disease had symptoms consistent with MIS-C and received antimicrobials, inotropes, and anti-inflammatory agents compared with those with non-severe disease. Approximately 89% were discharged and 3.6% died. So with regards to the outcome, several studies have reported a U-shaped curve of severity in children diagnosed with COVID-19 in infants under 1 year of age and adolescents 10 to 14 years of age at higher risk of developing severe COVID-19. There are regional differences that were seen in the comparison of clinical features, treatment, and outcome between high and low-income countries. Studies in high-income countries showed higher proportion of cases with fever, neurologic symptoms, abdominal symptoms, and other symptoms consistent with MIS-C. Studies from high-income countries also showed that more children with comorbidities, ICU admissions, and mechanical ventilation and administration of treatment with various drug regimens, whereas studies from low-income countries laryngeal erythema were more. There was a higher proportion of children hospitalized in lower income countries compared to high income countries, and also higher mortality rates seen. Due to insufficient data, we don't know if the observed differences in these mortality rates were related to differences in available hospital resources or differences in severity of illness or higher baseline rates of death in lower income countries. So now let's take a look at our local data. The Salvation study, which stands for Surveillance and Analysis of COVID-19 in Children nationwide, is an online registry that aims to capture epidemiologic and clinical data on COVID-19 in the pediatric population. The Salvation study is an initiative of the Pediatric Infectious Disease Society of the Philippines in cooperation with PPS, the Philippine Pediatric Society, and in partnership with the University of the Philippines Manila National Telehealth Center and 101 Health Research. Data on the epidemiologic profile, clinical and laboratory features, treatment, and outcome of children less than 18 years old with probable or confirmed COVID-19 and admitted or are collected retrospectively is Dr. an esteemed pediatric infectious disease specialist and a staunch vaccination advocate whom we lost due to COVID-19. So from July 2020 to April 3, 2021, the registry had a total of 972 patients reported, which is actually just a small proportion of the over 142,000 pediatric cases below 20 years old that has reported by the Department of Health. Now, data collection and analysis is ongoing, and information is expected to evolve as more patients are enrolled. Majority of the reported cases are patients admitted in hospitals, with a small number of reported patients managed on an outpatient basis. There were slightly more males at 56%, and disease severity was classified as mild in 38%, moderate in 25%, severe in 7%, and critical in 10%. Among the age groups, children 1 to 5 years old had the greatest number of cases, followed by the 11 to 15 years old. Approximately 5% in each of these age groups had mild cases. Majority of COVID-19 patients were symptomatic because in general, the children were tested for SARS-CoV-2 only when they had symptoms, while a small number are incidentally tested as part of contact tracing or as part of workup for another condition. The most common clinical manifestations were fever, cough, and difficulty breathing. Other symptoms were colds, gastrointestinal symptoms like diarrhea, vomiting, and abdominal pain. The laboratory results showed greater elevation of inflammatory markers such as procalcitonin, ESR, D-dimer, ferritin, LDH, and IL-6, with the elevations more marked in those with severe and critical COVID-19 compared to those with mild or moderate disease. The chest X-ray was abnormal in 53%, and the most common findings were unilateral peripheral ground glass opacities. The proportion of those with abnormal CT scan was significantly higher, which indicates that the CT scan was more sensitive in demonstrating lung abnormalities, even in those with normal chest X-rays. Consistent with the other studies, comorbidities were present in 26% of cases, while co-infection was present in 13.9% of cases. There were no cases of immunosuppression detected, but the other comorbidities that were reported were hematologic disorders, cardiac disease, neurodevelopmental disorders, and kidney disease. The most common co-infection was dengue and hospital-acquired pneumonia. It is not shown here, but there were 11 cases of MISC in this series, ranging from 8 months to 11 years of age, all recovered except for one mortality. Given the typically mild course of COVID-19 in children, supportive care alone was administered for most cases. Only 27% required oxygen support, and of those who required oxygen support, 64% were non-invasive mechanical ventilation, while 36% required mechanical ventilation. At this time, there is no evidence-based therapy effective against COVID-19 for children, and in this study, only a few patients received at least one treatment aimed at modulating the course of the infection. The most commonly used drugs were corticosteroids, IVIG, and only a few were given remdesivir and interferon. Convalescent plasma was given in 6 patients. The outcome is generally good, with 82% who recovered. There were 93 deaths, most of whom were admitted to the hospitals with severe or critical COVID-19. In addition to the registry, I would also like to present our experience in the Philippine General Hospital. As you may be aware, PGH was designated as one of 4 COVID-19 referral centers in the early part of the pandemic last year. The hospital was divided into COVID and non-COVID zones. The pediatric COVID areas were located in the 5th floor of the central block buildings. Initially, there was a COVID ward which was able to accommodate 9 to 12 patients, and a separate NICU-COVID area where infants born to mothers with confirmed or suspect COVID-19 were cohorted separately. Currently, all SARS-CoV-2 positive pediatric and neonatal patients are admitted in the same COVID area, separate from the non-COVID patients. So from April 2020 until April 2021, a total of 195 pediatric COVID-19 patients were admitted in PGH, 169 with PCR confirmed COVID-19, and 26 with probable COVID-19. Of these, 60% were asymptomatic or had mild COVID-19, 20% were moderate, and 20% each were severe or critical. The increased prevalence of severe or critical cases in PGH could be explained because PGH is a referral center. For the age distribution of the admitted patients, most of the confirmed cases were 11 to 19 years old, followed by the 0 to 5 months old. So in our institution, the admitted cases were older than those in the Salvacion online registry. The most common clinical presentation was respiratory distress, fever, and cough or colds. This is consistent with the other studies and with the online registry. Now, unlike findings in the online registry where only 26% had comorbidities, in those who were admitted in PGH, majority or about 60% of the patients had comorbidities, hematologic disorders, neurologic disorders, cardiac and renal disorders were the most common underlying diseases reported. The general outcome was good, with majority being discharged. However, there were 21 deaths, mostly due to the underlying condition. What about infants born to COVID-positive mothers? One study in PGH showed that majority of pregnant women with COVID-19 infection and their neonates had good outcomes. Of 209 pregnant women with confirmed COVID-19 infection admitted in PGH from April to August 2020, there were 196 deliveries. 63% were delivered abdominally due to an obstetric indication. There were 4 maternal deaths, and of these 4 maternal deaths, 1 was a direct maternal death due to pulmonary embolism during the 2nd stage of labor, and the 3 remaining cases had comorbidities such as sepsis, diabetes mellitus, and ASD with Eisenmenger syndrome that made them at risk for fatal COVID-19 infection. For the neonatal outcome, there were 192 live-born infants, all singletons except for 1 set of twins. Almost all of the infants in this study were born term, exhibited good APGAR scores, and had birth weights appropriate for gestational age, with APGAR scores 8.6 and 8.8 at 1 and 5 minutes on the average. So only 2 neonates, so that's 1%, tested positive for COVID-19 infection. 1 was a 31-week-old preterm who eventually succumbed to sepsis with DIC, and the other, a stable-term infant who was eventually discharged. So overall, labor, delivery, and the immediate postpartum course were generally uneventful, and the prognosis was good. However, this generally good outcome in neonates born to COVID-19 mothers is contrary to findings from other studies. In this multinational cohort study, comparing the risk for maternal and neonatal complications in pregnant women diagnosed with and without COVID-19. This study included more than 2,100 pregnant women in 18 countries and found that COVID-19 infection during pregnancy was associated with substantial risk for morbidity and mortality in postpartum mothers, as well as for their infants worldwide, compared with their not infected pregnant counterparts, especially if these individuals were symptomatic or had comorbidities. So for the next few slides, I would like to show you our guidelines for the management of COVID-19 in children. However, because of lack of time, you can watch the replay of this video if you want to see details. So in our management, we classify the patients as having suspect, probable, and confirmed COVID-19, as well as classifying them based on severity. So based on severity, then there is a corresponding treatment regimen. So this is for mild to moderate. Then we have for moderate to severe, wherein we start them on steroids. And then we also start them on the antiviral remdesivir. For children also with severe or critical COVID, we also give them tocilizumab and convalescent plasma or IVIG. Now, of course, we know that these drugs are investigational drugs. So before we give them, we make sure that we get the informed consent first before initiation of the treatment. Okay, and we also have treatment guidelines for MISC. All right, so what about the long-term outcomes of children? So there remains paucity of studies reporting the long-term prognosis of COVID-19 in children, including those who report mild symptoms of infection. A small proportion has been shown to develop prolonged symptoms, meaning more than 2 months, and symptoms may last up to 6 to 8 months. Majority of these patients with prolonged symptoms were pre or adolescents 9 to 15 years old, and there were more females who will develop prolonged symptoms. The most frequent manifestations were extreme fatigue or weakness, dyspnea, heart palpitations, chest pain, severe headache, persistent low-grade fever. So children may also experience long COVID symptoms similar to adults, with females being more affected than males. So long-term follow-up of children with prolonged COVID symptoms is important to monitor their health and well-being, including mental and psychosocial support. So in this last slide, I would like to present some important challenges and issues concerning COVID-19 in children. So in addition to the risk of disease and illness, COVID-19 has led to changes in schooling, health services delivery, and other disruptions of normal routine that are likely to affect children's health and well-being, regardless of whether they are infected. So the challenges and issues that could negatively impact the health and well-being of children can be grouped under 3 broad categories: social isolation due to social distancing policies and school closures. Second is disruptions in medical care and social services. And third, economic and societal disruptions. So social distancing policies and school closure has resulted in reduced social connections and physical activity for children. And to address this concern, it is important to recognize and address the fear, stress, and behavioral changes, offer mental health and psychosocial support through telehealth, and help children stay socially connected, as well as finding alternate ways to connect and support each other at a distance. Health risk due to disruptions in medical or health care has occurred during the pandemic. And we know that continued acute and chronic well-child visits is important, particularly for children with special healthcare needs, such as those with intellectual or developmental disabilities, those with underlying comorbidities, immunosuppression, and those with ongoing illnesses such as tuberculosis, HIV, and other diseases. This can be carried out through telemedicine or telehealth with complete in-person elements once the community circumstances allow. So we need to remember from the previous slides that the presence of these underlying comorbidities in fact increase the risk for severe COVID-19 disease and poor outcomes, and hence the importance of continued healthcare services. And then lastly, health risks due to loss of family income. So COVID-19 has led to a surge in unemployment and income declines for many families with children. So many families are now experiencing loss of income, food insufficiency, or problems in paying rent since the pandemic. So now is the time to maintain a trustworthy relationship and open communications with children, even as it becomes the duty of the government to provide security to those families who need economic and social support. So to end, let me summarize my talk on COVID-19 in children. So children represent less than 10% of diagnosed COVID-19 cases. Children predominantly contract mild form of infection, but they still could be at risk of more severe outcomes. The local data are generally consistent with published data, and further studies are needed to determine optimal treatment for children, including those with prolonged symptoms. So thank you very much for your attention.
Okay, thank you very much. That's Dr. Chet Gonzales, who is the Associate Dean for Faculty and Students at the University of the Philippines and one of our leading pediatricians in the country today. Thank you, Chet. So we're going to go now into a series of reactions. And as we mentioned earlier, we have a little surprise for you. We thought because we're talking about children and COVID that we should actually bring some young people into this conversation and not just have adults talking among themselves. So we do have two very, very special guests who are youth coming from two different parts of the world to talk about COVID. And let me turn you over to Raymond, who will introduce our first young speaker. Go ahead, Raymond.
Thank you, Dr. Susie, and thank you to Associate Dean Chet Gonzales for that really informative data and how it compares to the global data, at least for the published ones. At this point, we call on our first youth speaker po. She all the way from the East Coast in the United States, Millie Rose Walker. Welcome to the webinar. I think it's a little past midnight over there. And we hope that you still have the energy to keep up with us. So thank you. And thank you to your mom, Cecilia Walker. Go ahead with your reaction.
So I had COVID in early March of 2021. And so I had it from, I think I contracted COVID on March 8th. And before I had COVID, like the week before I tested positive for COVID, I was feeling really tired and exhausted, which I thought was from school. And I had like kind of a sore throat. And then the Saturday after school, I woke up and I felt so exhausted and I was lethargic and like, I couldn't think and I was really unmotivated to do anything. I had headaches and I had aches like on my body and I really wasn't feeling well. And I thought I was like gonna have a fever. So I talked to my mom and then on Monday I tested for COVID and an hour after my test, I tested positive. So then during COVID, I was actually really surprised because it was a lot more mild than I thought it was going to be. I had a stuffy nose, but I didn't experience any coughing or like tightness in my chest. I didn't have a fever. It was really mild for me. I thought it was like more mild for me than like I thought the common cold is. And it lasted for like about 2 weeks. And then after my stuffy nose went away, I realized I couldn't smell.
And currently, Millie still has no sense of smell 4 months later.
So is that something that Millie, at least in your age group, have you heard any similar experiences to yours?
I know a bunch of my friends have had COVID, but I don't think any of them have lost their smell or have had lingering symptoms.
Okay. Okay. So how is it in the Boston area? Have you gone back to school for face to face, or how is it generally over there?
It's pretty good over here. So school just ended for me, but we did go back in person. Like all of my classmates and we were in school. We did have to wear masks, but we were there like full day. And now nobody has to wear masks outside anymore. But if you're in federal buildings or using public transportation, you do have to wear a mask. And
Okay.
yeah.
How about for
So,
PE?
yeah, go ahead, Raymond, go ahead.
How about for PE classes? Is that something that I don't know if you have to do it at the gym or outdoors? How about the mask requirement?
So we did do PE outdoors, but then like our teachers who are vaccinated and they allowed the kids to take off their masks outside as long as we stayed 6 feet apart.
Okay. Dr. Susie, any questions?
Yeah, Millie, what was the first thing that came to your mind when you were told that you were COVID positive?
I really just didn't want to infect my sisters because I was around them at the time because we do everything together. So I was just I really didn't want to infect anyone in my family. And I was also really worried about how I would be. I didn't want to go to the hospital and get sick like I've seen people on the news.
Yeah, I'm going to ask your mom a question. Same question for Millie's mom. What came to your mind? I understand you come from a family of doctors, and
Yes.
when you found out she tested positive, what was going through your head?
Initially I thought, oh my gosh, we've gone a year and have avoided COVID. And all of a sudden, we were so close to the vaccine being available and someone in the family tested positive. So I thought immediately, Millie's a triplet and she shares a room with her two sisters. I thought we're all going to get it. It's in the house. So there's no way that and luckily, her sisters didn't get it, and everyone seemed fine. It was surprising to me actually how we were able to avoid it initially. Once Millie tested positive, we had to isolate her in the house, so she was in a separate bedroom and had to eat in the kitchen. We took shifts so that when everyone had left the kitchen, Millie could come down and eat in the kitchen. So, she was using her own bathroom. And so that was challenging. But I think, shortly when Millie had the lingering symptoms, and I was surprised that she still had no sense of smell a month later. And we took her back to the pediatrician, and she had said that only recently in 2021, in the past month, so in the month of March, they had seen a higher case of children with myocarditis. So because Millie had the lingering symptoms, she had asked Millie to stop any physical activity and go get an EKG. So Millie had an EKG and it came back abnormal. Her resting heart rate was 120 beats per minute. And she had a little bit of I think it was inverted T waves and a little bit of atrial enlargement. But we followed up with a pediatric cardiologist who did an ultrasound and repeated the EKG and said that it was temporary, that Millie would just have to recondition her heart. So slowly do 5 minutes of walking, then increase to 10 minutes and try to, and just kind of recondition her heart. But she assured us that nothing was wrong with Millie's heart. It was just a matter of it was just temporary. So,
yeah, Millie.
So we go back, we'll follow up every in another 2 months or 3 months, we follow up with the cardiologist.
Thank you. Millie, how did your friends react to hearing that you had COVID?
They were all surprised, and then they were all asking me like if my sisters had got COVID, and I told them no. And yeah, they were just really surprised that I'd gotten it, and they were like asking me how it was, and I told them like it was mild, and then I also told them that I still can't smell.
Okay, so thank you, Millie. Please stay. We're going to have a panel discussion. Raymond, did you have a last question, Raymond? I think we have something from the audience.
No,
Go ahead.
I think one of the last questions was, has Millie or anybody among your siblings been vaccinated?
No. Only like my mom and my dad have been vaccinated.
Yeah, in the United States, their children aged 12 to 17 are eligible. They did last week actually put a pause or had some concern about myocarditis with the vaccine, but we heard that the risk of myocarditis is greater if you contract COVID than if you get the vaccine. So that was just a few cases. Millie, they're telling everyone if you've had COVID, you have to wait 90 days before you're eligible for vaccine. But because of now this, some of the new studies coming back with children getting myocarditis from the vaccine, they've asked Millie to wait. So the girls have not gotten the vaccine yet.
Okay, thank you very much. And please stay. We're going to have you in the panel. All right, our next speaker is a young man from the Philippines. My pleasure to welcome Patrick de Guzman, who is a very outstanding student and leader in his school. And I'll turn the mic over to you, Patrick, so you can talk a little about, what did you want to say? And then Raymond and I have some questions for you. So go ahead, Patrick. The floor is yours.
Hello, can you hear me?
Yes.
Yes, loud and clear, Patrick.
Hello. I'm Patrick, and as a person who stayed in like the house the whole time for around 17 months now, I find it tough. It's a bit restrictive. It's I mainly have to stay at home. And 2 weeks ago, I just started my 8th grade. I have to have online class at home because I'm vulnerable to the virus. And essentially, my family, I'm the homebody. That I stay at home all the time. Even before the pandemic, I always like staying at home. And during my free time, I have a lot of free time in the pandemic, especially for the summer. I play games, watch YouTube, chat with my friends, of course, online, chat with my friends online. And the only really outdoor activity I do is just like watering the plants outside my house. And at times where my parents and my sister would go outside my house and attend important events and businesses, I would stay behind at my house with guardians because again, I am vulnerable. And my parents and my sisters also vaccinated. They're already fully vaccinated. They just recently got their second dose. But except for me, there's no vaccine for my age, or for at least here in the Philippines. I did hear they were testing vaccines in America for like people like my age. And the vaccine really is just the best protection for people. And since I don't have the vaccine yet, I have to be careful inside my house. My mom is a baker. She has like staff, like customers come in the house every once in a while, and even inside the house I have to wear a mask and wash my hands more often. And I really started taking it seriously. Last year at November, my dad got COVID. Luckily, none of us, my sister, my mom, me, no one else got infected. And that's when I really started washing my hands more, and like social distancing even with my sibling and my parent. And online s- uh online schooling, it's it's well, compared to physical school, it's very restrictive. Like for example, in physical school, we can interact with our classmates, we can talk to them, we can talk to the teachers. And online, there's a lot of problems like internet connection, and we're very limited to talking each other in Zoom classes. And at school, we all like at lunch, we do lots of games. Like I play lots of sports like football, baseball. But in online, we can't really do that. I can't really meet up with my friends as much, especially the workload in online school. And then like in online school, like there's PE classes. In physical school, it's more fun. We have like these games, and then we exercise together. And then online, it's like it feels isolating. Like you only see your friends and classmates through a screen. And it can really have a mental impact to me. And I really miss my classmates and my school physically. And I can't really talk to my classmates again because we can't really go out, we can't like have birthday parties, we can't have play dates. I can't even meet with my relatives. We only resort to Zoom classes or Skype. And we it isn't as much as fun as in physical, because we can do all sorts of games. But at least there's always a positive things to everything. Like for example, my parents stay at home. My parents stay at home more than usual, more than uh compared to before the pandemic. Right now they have their own Zoom meetings too, and we get to have mass every Sunday. We watch the mass in YouTube. I really hope there's more interesting things we could do at home, because we can do only so much until it things get boring. If you do something too much, it really gets boring. And honestly, the the only thing that keeps me sane is just talking to my friends. And I really hope the pandemic will end soon. But in the end, we should all look forward to a healthier and safer future for all of us. Thank you.
Thank you, Patrick. Thank you, Patrick, for sharing that. Before we let you go, because we're gonna have a panel discussion, I was just gonna ask you, what do you do, Patrick, when you're feeling that it's affecting you mentally? What do you do?
I would usually talk to my parents, my friends, maybe try to get it out of my head by doing my hobbies, like watching YouTube, playing games. And maybe I'd even try to find new hobbies to like distract myself from what's happening outside uh in the world. Yeah.
Okay, thank you, Patrick. Raymond, did you have a question for Patrick?
No, I just wanted to ask Patrick. He seems like a very very mature kid, and just wanted to ask him, how soon do you would you wish to go back to school, or maybe be able to interact with your friends again?
um like at first when the pandemic started, and then they announced online school. I was celebrating because I didn't have to go out. But then over time, I just miss my friends. I just miss them. Seeing them physically. Also my teachers, and like playing. Those those play dates and parties and all that stuff. Yeah.
Okay, thank you very much, Patrick. Don't go away. We're going to have you on the panel. And let me turn it over to Raymond for our next speaker. Raymond.
Thank you, Patrick, and thank you, Dr. Susie. Our last reactor, as mentioned, we have a representative from the Department of Education. He is the Undersecretary for Curriculum and Instruction, none other than Dr. Diosdado San Antonio, to give his reaction from the Department of Education's perspective. Yusek Dado, good afternoon. Okay, there we go. Yusek Dado, go ahead, sir.
Thank you very much, Raymond. Thank you very much, Dr. Susie. Good afternoon, everyone. Of course, we all know that in the Department of Education, we are not yet able to provide the face-to-face classes that all of us would want to have. We understand from the presentation of Dr. Chet Gonzales that indeed the kids may not be so prone to getting infected, but we also respect the decision of the president, particularly in putting premium to the health and safety of the children and of the Filipinos. Much as we personally, I've been a teacher myself for more than 36 years. I feel that if we would want to really make sure that the youngsters would be able to continue to learn the component of face-to-face, like blending the delivery of basic education services could also be possible, considering the data that we also knew even at the start of this COVID-19 pandemic. But as I've said, we are respectful and we agree that the health and safety of the children and of our fellow teachers is of better importance than making happen our dream of a face-to-face class for everyone, like even if they are done on a limited scale. Thank you.
Okay, thank you, Yusek Dado. Thank you so much. At this point, I think would like to call on all of our speakers for today. We have obviously we have Yusek Dado, but would like to call on Patrick again, and maybe Executive Director of the Climate Change Commission, Manny de Guzman can also join Patrick, Millie, and her mom Cecilia. We also have Dr. Chet, obviously, and Dr. Eusebio. Okay, but before we start, let us go first TVUP on our fun quiz, and just to go through the questions. There we go. Okay, so for the two questions that we have, what are the most common presentation of COVID-19 in children? 66% of responders selected fever and cough, followed by 42% fever, and then 26 and 27% itchy throat and cough. And then for the second question, what is the first line of management for mild COVID-19? An overwhelming 78% chose all of the above, followed by 8% hydration, 6% pediatric consultation, and then 5% paracetamol. Okay, Dr. Susie?
Okay, so we've got everyone on the panel now, and we're going to have questions from the audience too. We actually have two of our pediatricians from outside of Metro Manila who are going to be part of our discussion this afternoon. But before we go into that, I was going to ask, maybe I'll ask Millie and then Patrick first, if they had any questions for each other, because and there are questions in the chat. Patrick is 13 and Millie is 14, and they're on two different parts of the world, but I think you can hear similar threads in what they're talking about. But I just wanted to ask either Millie or Patrick to start off with a conversation between you two. I guess it must be interesting to learn more about somebody your age in another part of the world. So I'll start with Patrick. Do you have a question for Millie?
Actually, yeah. How did you feel when you like when you learned you got COVID, and how you're being treated, and when you were recovering, and how did you cope? How did you cope mentally and emotionally?
So when I tested positive for COVID, I was really nervous, like how my body was going to react. And I didn't want to I really didn't want to be in the hospital and be on a ventilator like I've seen a bunch of people on the news. And then I was really, really relieved when all of my symptoms were mild. And then after COVID, when I learned that I was having trouble with my heart, I started to get nervous again because I didn't want to have a heart attack or be in the hospital. And I just wanted to be back to normal and be able to play sports and just be healthy like my sisters were. So I was just really nervous the whole time. But then when my doctor told me that I was all right and I just needed to recondition, I felt really glad and relieved.
Hey, Millie, do you have a question for Patrick? Patrick has been in the country with the longest lockdown in the history of the world. So do you have a question for Patrick?
I was wondering when or would you feel comfortable if you get vaccines in the Philippines, would you feel comfortable going outside again, being in public, being in school, being around people? Would you feel comfortable?
Like if you haven't gone outside in a long time, thinking and you're thinking that the virus is still there, of course I'll still get scared even if I get vaccinated. I'll still probably social distance because I'm probably gonna be paranoid. I'm gonna be paranoid, but at least I can see people physically and interact with them.
Okay, great. Okay, so you guys, Patrick and Millie, take a look in the chat. Millie, a lot of people are cheering for you. You didn't really go through you didn't really go through an easy time. I mean, this is a difficult situation for you, and people are cheering you on in the chat box. So let's go to our question. So I don't know, USEC dads, did you want to ask Dr. Chet anything in relation to her presentation?
Dr. Chet, so what do you recommend if asked? Is it safe to have limited face-to-face, observing social distancing, fewer learners in a classroom, especially in far-flung areas?
Sir, thank you for the question. I think that has been going on in the minds of many people. Personally po, I would have to say that if ever we open, it has to be it cannot be nationwide. It has to be phased.
Yes.
Or in just selected areas, because there are many things to consider. Although we do know that children get mild disease or are not as susceptible, still they can get the infection. And so before we open, we have to consider is there ongoing community transmission? Are the teachers vaccinated? Are the schools, the infrastructure, are you prepared? Do you have enough ventilation? Can you is there enough space to be able to ensure that the children are distanced at the appropriate distance? No, they have they have appropriate physical space. No, so there are so many things to consider. But having said that, there are so many advantages also of starting schooling because of the mental um, effect that the prolonged lack of schooling has caused, no, to our children. So we have to consider that. And I was just thinking, if we are able to open our malls and business establishments, I think we also have to consider opening our schools at at one time or another. So maybe once we are ready, we can make open a few areas at a time, knowing the situation in that area. So I hope that helps, sir. I know it's a difficult situation to have, no, whether to open or not, because I agree, safety of everybody concerned, our teachers, our school, the community, the children are, of course, of utmost importance.
Thank you. Thank you, Chet, and thank you, Doctor. Thank you, Yusek Dads, for that question. And I think we've got two pediatricians from the Philippine Pediatric Society that Raymond's going to introduce them. And they are coming from different parts of the country, both very different contexts. And I think, really, I think I agree with Chet. This is really about understanding what's happening in terms of the community and looking at community transmission as something that we need to strongly consider when we're thinking of going back to school. So Raymond, over to you for our two doctors from the Philippine Pediatric Society. Go ahead.
Thank you, Dr. Susie. So for our first representative, he is chapter president for Southern Mindanao of the Philippine Pediatric Society, Dr. Sheldon Paragas. And our other guest is the chapter president for Northern Luzon of the Philippine Pediatric Society, none other than Dr. Efren Balanag. So Dr. Balanag and Dr. Paragas, welcome po to our webinar. Any brief reactions to the topic, sirs, or anything that you'd like to share to our audience? Let's start with Dr. Balanag, then Dr. Paragas.
Thank you very much for inviting me to be a reactor. So far, it has been a very fruitful interaction, especially with the feedback coming from our children themselves. So I would just like to give a little background on our situation here in Baguio. No, basically we have the same demographics with that of what is reported by Dr. Chet from PGH. In my place of practice here in Baguio General Hospital, which is also an identified COVID referral center, here in the Cordillera Administrative Region, we have 206 pediatric cases of COVID so far. And half of the total cases, or around 105 patients, of which have mild symptoms, followed by moderate of around 48, and 7 cases presented as severe, and 7 cases were critical. And around 39 children, though, were asymptomatic. Of the 206 pediatric cases, more than half, or 112 cases, belong to 0 to 4 years old, followed by 5 to 9 years old with 37 patients, and 15 to 18 years old with 32 cases. The least number of cases belong to 10 to 14 years old bracket, around 25 cases. And the top 5 clinical presentations are also respiratory symptoms such as cough and colds, fever, diarrhea, seizures, and sore throat. And the most common comorbidities are those patients with malignancies or cancers, patients with dengue, surgical and neonatal complications, and neurologic symptoms or patients. And of the 206 cases, we had 11 deaths. So far, most common comorbidities for these mortalities are 2 cases of dengue severe and 2 cases of severe RDS, and one of which with epilepsy, hydranencephaly, bronchial asthma, lymphoma, DIC, and meconium aspiration syndrome, and obesity. So those are the demographics here at BGH and Baguio in general. One common problem I would just like to ask Dr. Chet is that the most common dilemma is the question of separation from the caregiver. Like if a pediatric patient is positive and the immediate caregiver is negative, how do we go about it? Do we sacrifice the negative caregiver just to be with the sick, positive child? Because I believe this is one of the cause of underreporting. They don't want to get separated from for the fear of being taken away from their primary caregiver.
Okay, so usually what we do in PGH is we test both the patients and the caregiver. Okay, so we if the patient is positive, and I think it's a matter of whether we have a proper isolation room for them. If there is no other caregiver, then if the caregiver is your situation is the caregiver is negative, okay. As long and there's no other caregiver who can take care of the patient, is that the condition?
Yes, especially if for very young patients who need to be breastfed like that.
Okay. I would if there is no other caregiver who will take care of the patient, especially if the caregiver is also at risk, like elderly or has comorbid, I think that's risky, and I would not recommend that. No, it would if there is no other caregiver, I think that it should be clear to the caregiver about the risks of getting the infection. If the caregiver is fully aware that he or she might be at risk of developing complications, especially if this patient is elderly or has comorbid conditions, then he has to be informed. And then, having said that, it would be important for this caregiver to practice the appropriate standards, of prevention. So wear mask, face shield, wash hands always. So I think that's the only way that we can go about it, because of course we cannot separate the primary caregiver from the child. So I think that's the best that we can do.
Yeah, I really like that question, Doc Efren, because it's a very special situation for children, and it just brings me. Maybe we're gonna ask Dr. Eusebio to also comment on this, and USEC dads. But once we open school, and you have a child who has symptoms, then the school will probably have to have some kind of facility and some health workers who would be able to manage possible infections. So I was going to ask Dr. Eusebio, from the point of view of PPS, is it possible that our pediatricians could be working with our schools just to prepare? Because again, right, we don't know, not everything is isolation in a hospital. And a lot of cases are mild. But there could be instances when we open up where you have a child who you find out that a child tested positive, and the school then has to make a decision on what it's going to do. So is PPS, what are your thoughts on how PPS could be helping our schools when we start opening?
Yeah, well, actually, just for the information of everyone, about 2 days ago, the DOH convened the child health experts together with DepEd, with the educators and some other stakeholders, and we discussed about this reopening of classes. And as mentioned by Dr. Gonzales, there were a lot of our recommendations that were set and presented to the body in order for it to more or less happen. But we always have to start from maybe piloting initially, it in certain areas that are of low risk, and to ensure and make sure that the school will have provisions for all the health safety measures that need to be followed. And together with that also is how to identify what needs to be provided for or done if ever that the child will have the sickness or the illness, and what are the support system that has to be provided for by caregivers, and so on and so on. So in other words, if I'm going to answer your question, yes, the pediatricians have important roles in more or less helping the families understand, and even the educators at that, in more or less emphasizing to them the importance of the health safety measures and to support the mental health of the children. Yeah.
Thank you very much, Dr. Eusebio. Yusek Dads, did you want to add to that conversation?
Of course, we are grateful that Dr. Chet and Dr. Eusebio have practically affirmed what we are trying to do in the Department of Education as we prepare for the limited face-to-face. It will really be in phases. And of course, while we know that the trend is becoming like harder in the areas originally identified as low risk, but we are also aware that there are certain areas, for example, in Calabarzon, there's a town that's an island into itself where COVID transmission from outsiders may be very difficult. Then this is something we can perhaps explore. But yes, we have taken note of those things, and those are the things that we are trying to look into now, especially the risk levels at the communities where limited face-to-face classes may be done. I understand our original list of the pilot schools was more than 1,000, but lately I think we had to reduce it to about 300 across the country. But yes, we also wanted to do this in phases because we have to monitor and learn from our experience and find out how we can do it in bigger scales later on. So the inputs from the professionals would also be very important to us, so that the decisions made will be consistent with the opinions of our experts in terms of this COVID-19 disease among children. So we're very grateful. Yes, there's a strand in the Department of Education that actually works with our partners. And unfortunately, I don't belong to that strand. It's on, I think, the USEC in charge of administration and health services.
Okay, so thank you very much, Yusek. Talking about low risk and high risk areas, let's talk to somebody who's in a very high risk area. So Dr. Sheldon Paragas from Davao. Please, hi, welcome, Sheldon. And please take the floor. Tell us what's happening in Davao and what you're thinking, and if you have any question for Chet or for our young folks on call. Go ahead, Sheldon.
Okay, thank you very much, Dr. Susie, and as well as Dr. Raymond, and for the rest of the team with this webinar. So I represented Davao Southern Mindanao Chapter, the Philippine Pediatric Society, and to give you an overview, let me walk you through what happened when we started the pandemic last year. So in March 2020, we started gathering data and numbers as to how many of these children were affected. And then what is unique in Davao City, because we have a one hospital command. We're in Southern Philippines Medical Center. All of these suspects, as well as confirmed cases across all ages, will be admitted only to that hospital. So it's a dedicated hospital. The rest of the private hospitals, for example, when the pandemic started, they are not allowed to admit these types of patients. So all patients we are seeing patients in Southern Philippines Medical Center since March 2020. And among these, for the census, for the whole year of 2020, we had about 569 confirmed COVID positive patients, children, and then 254 up to this date, starting from January to June of 2021. If you're going to sum it all up, the total of 823 confirmed COVID patients, children, are admitted at Southern Philippines Medical Center. And if you're going to look into the greater picture, the total number of COVID cases in SPMC for the whole year from March 2020 up to this point, around 790. So it means we have only 3.8% of the total number of cases admitted in that institution. But we have to understand that since we had two surges in Davao in the last quarter of 2020 and now the second surge, so we are now opening other private hospital to cater these patients. And these private hospital are now allowed to cater mild as well as asymptomatic to some extent moderate cases. And then we are also having these temporary transient medical facility or TTMS across the Davao region, wherein all of these patients will be admitted, whether they are asymptomatic or mild. So it means that given the census of 823 cases of children with COVID, we don't know exactly the true census because we are only catering the moderate, the severe, as well as the critical. So we don't know who among these children who are asymptomatic and mild cases. So that's the scenario of our cases here in Davao City. So we are now trying to consolidate, make policies, review policies, and make new guidelines regarding how to combat these surges. We noted that when the National Capital Region had its surge, we are pretty much expecting that Davao will follow. So true enough, when the number of cases in the NCR went down, Davao cases went up. So yun yung nangyayari sa atin. So it means that for the Davao region, I think we have a total of 43,000. And then at present, we have 9,657 active cases as of today. And in Southern Philippines Medical Center, we have at least around, I think around, in Davao region, we have 4,000, Davao City rather, we have 4,000 active cases. So that is pretty much a bad picture, especially if you are dealing this one. So we have to reiterate again the policies and guidelines set by the government, the DOH, as well as the IITF. And we actually continue to educate people to get their vaccines among these, especially among the priority groups. So that's the clear picture. And regarding children with COVID, we had a total mortality of, I think, if I'm not mistaken, 31 patients in SPMC alone. So given that data, so at least we have only, rather the mortality rate are less than 5% of the total cases. So the same data presented by Dr. Chet, among this mortality, they have serious comorbidity. So hemo-oncologic comorbid conditions, cardiovascular, renal, as well as respiratory. And then we are also seeing patients with dengue fever. So that's the picture in our setting. And probably with this data, I think we can also work hand in hand with UPPGA to consolidate this one and then include in the Salvation trial probably. One of the questions I've frequently been asked since I am a pediatric cardiologist by practice is that recent reports about myocardial involvement or myocarditis regarding these types of vaccines, especially with the mRNA platforms shared by these vaccines rather. A lot of parents are very much concerned whether these children should accept this type of vaccine. So the same sentiments were raised in one of our panels. So I usually answer them back that yes, it is true. There have been reports about myocarditis, but again, as the other cardiologists from the other part of the world have said that the risk of having cardiovascular involvement, ventricular dysfunction, or myocarditis are much higher when you will be having COVID done through the vaccines. I don't know about if my perceptions are accepted by Dr. Chet. Can Dr. Chet share your thoughts about this one?
Chet, go ahead.
Oh, okay. This is regarding myocarditis, right? I think still in those who develop myocarditis, from what I've read, they're usually mild and self-limiting, and so as was mentioned earlier, the risks of myocarditis from COVID-19 infection itself is actually higher than the risks of myocarditis from the vaccine. So still, the benefits of vaccination would still outweigh the risks. And so if it becomes available, then surely I think vaccination would still be a better option.
Yeah, I don't know if I heard this correctly, but Millie, you had myocarditis, right? Or you have myocarditis? Am I correct?
I didn't have myocarditis, but they wanted to make sure I didn't because kids around my age who were having lingering symptoms of COVID were developing myocarditis. So that's why I had an EKG and an ultrasound.
But you didn't. It turned out that you were negative.
Yeah, I was all right.
She just has an elevated heart rate, so that will take time to recondition her heart by slowly building up the exercise and not stressing.
So, yeah, good. So that's something I think we need to watch out for. Raymond, did you have a question you wanted to?
Yes, very interesting
go ahead, Raymond.
question. Thank you, Dr. Susie. Just because it has already touched on by Dr. Paragas and Dr. Chet, I'd like to continue on. We'll address this to Dr. Chet again. And this is from our pediatric dentistry colleagues po, no? I'll just read the question. Have we seen, based on the Philippine data, have we seen cases of COVID-19 in children that manifest oral lesions? Our pediatric dentist colleagues, especially from the international community, have been seeing lesions in the oral cavity in COVID-19 children cases.
Oh, okay. That's interesting. I have not seen any in the report, but maybe having mentioned that, maybe it should be specifically observed or looked for in patients with COVID. I'm just wondering what type of lesions are we talking about? Ulcers? I haven't seen personally. I haven't seen, unless we're talking about oral ulcers in relation to MISC, because I have seen like chapped lips and gums and things like that, but in relation to children with MISC, not the ordinary COVID infection.
Yeah, thanks, Chet. Dr. Efren Balanag wanted to say something. Efren, go ahead.
Yeah. I would just like to ask the young adults regarding their feedbacks. Now, one of the possible backlash of being COVID positive is the stigma attached to it. One way or the other, if other children knew a classmate had the COVID, is it a possible cause of bullying or avoidance from other classmates or parents of other classmates? That's one. And another question is, what are the feedback of children regarding the swab test? How traumatic is the experience for them to be poked inside their noses?
Okay, great. I think let's start with Patrick. Patrick, do you think somebody who got COVID would be discriminated or would receive stigma? And did you ever get tested? What was it like for you? Go ahead, Patrick.
I'd say yeah, I mean, because first they want to stay away from the person who got the disease, and also I heard news in America, those like Asian hate, I think, because China, the virus, and actually yeah, I did get the swab test, and for me it wasn't really traumatizing or anything, and it didn't really hurt. It didn't really hurt. It didn't really hurt that much. Yeah. If anything, it was just ticklish.
Ticklish. Okay, that's nice. Let's go to Millie. Millie, have you sensed that because you tested positive, your friends know, you think people are avoiding you?
Well, I know a bunch of people like didn't say anything about having COVID because they didn't want to be like shamed for going against restrictions or like seeing people like and doing all that stuff. But I don't think people necessarily wanted to avoid me. I think they were more interested in like how like the whole process was. But definitely there were a lot of people who really didn't mention having COVID until like the end of the year because they were afraid of what other people would think.
Yeah. And how about testing? How's testing been for you?
Yeah, like Patrick said with the nasal swabs, I didn't mind it. Like I know some people have a hard time with it, but yeah, I thought it was like ticklish.
Okay. So I think it's the adults don't like it. The kids seem to like it. All right. Raymond, did we need to go to the answers to the questions before we do something else, or
No, I think we're okay, and most of the questions have already been addressed, Dr. Susie. I think at this point,
okay.
we'd like to ask TVUP to show our evaluation poll. There we go. Okay, so I'll just read off the list as our resource speakers compose themselves for their final statements po, no? The 5 questions are as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And then finally, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. Over to you, Dr. Susie.
Okay, thank you very much. We're approaching the top of the hour, and we're going to share a little public service announcement, during which time we're going to ask our panelists, our guests, our reactors to formulate a very short message for the audience before they go. So we'll give you a minute or so to do that while we share a public service announcement from the University of the Philippines. Go ahead, TVUP.
Sigurado ka na ba sa reservations natin?
Oo naman.
Bakit bihis na bihis ka?
Oo, magiging escort mo ko eh.
Mukhang may date si Lola't Lola.
Ilagay mo kaya ito?
Ang ganda naman.
Maganda yan. Special ang lakad natin. Ano, ready ka na?
Ready na. Mom, Dad, aalis si Lola't Lola. Oo, anak, after lunch. Sana lakad niyo po. Para sa atin lahat ito. Magpapabakuna kami dahil mahal namin kayo.
Dahil mahal ko kayo, magpapabakuna ako.
Okay. Thank you very much, TVUP. Just another reminder for our seniors that, and to our audience, that we have to get our seniors vaccinated. We still, I think the numbers are going up, but we really have to share this message that let's do it out of love, right, for our family. Okay, so let's go now to our closing remarks. And I'm going to start in reverse. So we're going to start with Undersecretary of the Department of Education, Yusek Dads. Go ahead, please.
Of course, we're very grateful to the organizers for the opportunity to be a part of this important initiative. And as in the Department of Education, we are very grateful to the whole country. Everyone has shown that Bayanihan is alive in the Department of Education. Everyone who cares. It's not just DepEd that has done its part in providing learning continuity for our youngsters. So thank you very much again to everyone. Mabuhay po kayo.
Thank you very much, Yusek Dads. Let's go to Dr. Eusebio from President of the Philippine Pediatric Society. Dr.
Yes, also, I would like to express my deepest gratitude for this forum, and that despite the fact that children are less affected, we know that its impact on our children is very, very much more than that, because it can even be lifelong because of the mental, socio-emotional impact it has on them. But as I have always, as I have emphasized earlier, on, we at the Philippine Pediatric Society is always at the forefront in and is committed to promote protect and preserve the best interests of the Filipino child. So whether this is before, during, or even after the pandemic. So thank you.
Thank you very much, Dr. Eusebio of the Philippine Pediatric Society, the president. We're going to ask also Dr. Efren and Dr. Sheldon to give some parting words. So Dr. Efren first. Go ahead, please.
I would like to thank this opportunity to be able to impart our knowledge, especially to our caregivers and to our pediatric patients, because we all know that the Filipino children they're the future of our country. So we have to take care of them.
Thank you very much. This is Dr. Efren Balanag of Baguio City. And let's go to Dr. Sheldon Paragas from Davao.
Okay, thank you very much. So I would like to take this opportunity to send message that protecting our children starts when we are protecting ourselves, the adults. So do not be afraid to be tested, especially when we have influenza-like illnesses or systemic viral infections. Do not wait for the rest of the household to be transmitted with this disease. And also likewise, do not be afraid to be vaccinated. That's all, Dr. Susie.
Thank you very much, Dr. Sheldon. Let's go to Millie Velasquez Walker from Boston, Massachusetts. Go ahead, Millie.
I just want to say, please listen to all the COVID restrictions. Wear your masks, stay 6 feet apart, stay at home. Ask your doctor if you have questions, do your research, get tested. And don't lose hope. Things will get better. They did where I am, and I'm sure they will get better in the Philippines.
Thank you very much, Millie. Patrick de Guzman from Santa Rosa in the Philippines.
Hi, I just want to say thank you again for inviting me. And I believe this pandemic will be in the past. And, eventually we will learn from our own experiences and we will work out for a better normal. Just stay safe, like what Millie said, wear your mask, follow the health protocols, wash your hands, and it will all be over soon.
Thank you, Patrick. Dr. Chet Gonzales.
Okay, I think it has already been mentioned by several speakers also that although children contract the mild forms of the disease and the outcomes are generally good, there is still a small proportion of children, especially those with comorbidities, that can develop severe COVID. And aside from that, we also know and we've heard from our young people, our young reactors, that the effect of COVID is not just physical, it's also mental and social. And I think as pediatricians and as physicians, we have to consider that also. Susie, may I just mention there were several questions with regards to vaccination
Go
in
ahead,
the
go ahead.
Q&A.
Yeah, go ahead.
Okay.
Chet, go ahead.
So I think just briefly, should children be vaccinated? Yes, eventually, of course, because when we say herd immunity, that does not mean 70 to 80% of people more than 60 years old. It means the entire population. So eventually, yes. And just like school opening, face-to-face, I think vaccination, there's a perfect time for that. That's it. Thank you.
Thank you very much, Chet. Yes, I do realize there are many questions about vaccination. And maybe at some point in time when we're ready, we will talk about vaccination for kids. But yeah, thank you so much for your presentation, Chet. Okay, to close our program, we are going to have a brief summary by the Chancellor of UP Manila, Dr. Carmencita Padilla Menchit. Go ahead.
Yeah, okay, thank you. So, well, good afternoon. So our webinar 59 was opened by Dr. Joselyn Eusebio, the president of the Philippine Pediatric Society. Our COVID experience was likened by Dr. Eusebio to a sci-fi thriller with all of us at the edge of our seats. And I think that's exactly what we're feeling right now. But we are not just worried whether the children will contract COVID, but we're now concerned how the children are coping up with this condition. And we have to start looking at the mental component of COVID. PPS is committed to collaborating with the Department of Health, the Department of Education, and all the agencies to make sure that we come up with policies working towards resilience, agility, and self-sustainability. I'm really happy to be part of PPS too, and I know that they've been contributing guidelines, policy statements, registries, and scientific information. The PPS has also contributed, shared their expertise actually as members of IATF and some committees of the Department of Health. And for that, we are thankful to PPS. Our main presenter, Dr. Gonzales, worked on the epidemiology, the registry, and the risk factors. So allow me just to give the highlights in the interest of time. It was clear that, Dr. Gonzales said that the children represent less than 10% of the diagnosed cases. Children are unlikely to be the major source of transmission. They predominantly contract the mild form, but still a certain percentage will have severe outcomes due to underlying medical conditions. I'd like you to review in the replay her discussion on the multisystem inflammatory syndrome in children, and likewise, the theories regarding the reduced severity and susceptibility in children. I found those issues very interesting. Now, just to mention some of the data that you'd like to bring home to your community in your ECHO seminars. The biggest collection in the literature has 9,000 children in their collection, and still the most common symptoms will be fever, cough, nausea and vomiting, diarrhea, and rashes. But generally, the management is still supportive. And of course, for moderate and severe, they will need hospitalization. Now, what I found interesting in the presentation of Dr. Gonzales is that she said that the risk of severe COVID-19 in children showed a U-shaped curve of severe COVID-19. That means infants, under 1 year of age, and adolescents 10 to 14 years. And note the regional difference. The high-income countries have a higher proportion of abdominal symptoms, the comorbidities, whereas the low-income countries had a higher proportion that was asymptomatic with cough and pharyngeal erythema, but a high proportion of hospitalized children with higher hospital mortality. And I think that is one part that's worth reviewing on why it is that is a situation in the differences. She mentions the Salvacion Pediatric COVID-19 registry, which is named after our former president in PPS who succumbed to COVID, presenting data, well-documented data of 972 patients, showing that still 80% are asymptomatic, but the majority will still be asymptomatic, and those who were symptomatic had fever, cough, and difficulty of breathing. Chest X-ray was abnormal only in 53%, with the CT scan being more sensitive. Further on, she said that a majority actually recovered, and then she discussed the PGH data. Now, in the PGH with 195 patients, it is interesting that the symptoms are actually similar, and majority are actually discharged. And that for the mothers the COVID-19 mothers who were actually delivered, that the newborns actually had good outcome, and only 2 neonates actually tested positive. So I think, with all of this information now, it has guided our societies to come up with better guidelines and better protocols so that we pediatricians and other subspecialties will be able to manage our patients better. Now, in closing, she actually talked about the issues for children that impact health and well-being. I think this is something that we should really take home. Number 1 is the social isolation needing social distancing policies. Number 2 is the disruption of routine services, wherein children with chronic illnesses must continue their follow-up with the doctors using telehealth. And the third will be the health risk due to the loss of family income. Now, we had 2 young reactors, Millie from Boston, USA, and Patrick from Manila, who shared their feelings about the situation, and they both of them were concerned with their families. Millie is in a hybrid situation and a modified educational setup, whereas Patrick is still in a remote setup. And the 2 of them actually highlighted exactly what Dr. Gonzales said, wherein social distancing policies must be given attention. we should offer mental health and psychosocial support, and we have to find alternate ways to connect and support each other at a distance. And I think, for us in the Philippines, this is going to be very important because everything is still on remote, whereas Millie in the US has started already the face-to-face with limited interaction. For USEC dads, it was good to hear that the Department of Education recognizes a difficult situation, and we're so happy to hear that you're now exploring limited opening of classes and by piloting in certain areas. And as you said, Bayanihan is alive in the country because there is a desire for continuity of learning. We had 2 reactors. We had two of our PPS presidents, Dr. Efrem Balanag from Baguio and Dr. Sheldon Paragas from Davao. And I'm really happy that they're also working on the registries, Baguio with 206 cases and Davao with 823 children with COVID-2. And yes, they have to be merged with the Salvation Registry data so that we can get more information and work better on policies. I think, the important thing now is hearing from Dr. Gonzales, from Dr. Eusebio, Dr. Sheldon Paragas, and Dr. Balanag. Data is very important so that DOH can actually come up with better policies that will affect the general population of children. So allow me to just, end with a couple of, shall I say it, food for thought. Well, number one, children are not spared from the mental effects of the lockdown. As a matter of fact, we must remember that the impact of the children may be lifelong. And, despite the desire to prioritize public safety, we must consider mental health effects of the lockdown. Mental health must also be given equal priority in planning together with public safety. So yes, we recognize and appreciate the efforts of all sectors in assisting government in arriving on a decision for the limited opening of classes. We look forward to that one. Interspersed in our discussion, we cannot overemphasize the importance of vaccination. We need it. And this has been shown in the sharing of Millie from the USA, wherein the vaccination rate is high. They have all opened their doors, their schools, their malls, and their parks. Now, this relaxation of the lockdown has improved the mental health status on their end. So in other words, here in the Philippines, we have to move towards increasing our vaccination rate so that we can actually also relax our rules for lockdown. So maybe, at the end, as we leave this webinar today, let us just remember that the impact of the children may be lifelong, and we, as a whole, as a community, as a society, we have to protect the future of our country. And as our 2 young reactors today said, it will be over soon. And we just have to take care of each other at this time. Magandang hapon po sa inyong lahat, and back to you, Susie.
Thank you very much. That's Dr. Menchit Padilla, the Chancellor of UP Manila. And before we close, of course, I would also like to thank our two young guests, Millie and Patrick, and their parents, Cecil and Manny, for allowing the kids to join us today. And I hope, Millie and Patrick, that this experience will make you stronger advocates for good public health in the future and as you grow up. Okay, so next week, don't miss it. We have a very exciting webinar. Is COVID-19 airborne, or is it spread by aerosol? Join us next week. We've got great presenters. We have actually people in engineering who will talk about how particles are suspended in the air, what is the current thinking on suspension of viral particles, and how COVID-19 is being transmitted. So, imbitahin niyo po. I know there are a lot of watch parties in the hospitals, not just one person watching, but groups. Please don't miss next week's webinar. Raymond, over to you.
Thank you so much, Dr. Susie, and thank you also for that excellent synthesis and closing remarks, Chancellor Padilla. Next week, not just engineers po, we also have a physicist, who will help us out, and also an infectious disease specialist as well as a communications expert po to help us understand the whole thing and how to communicate it to our lay people. So gaya po ng nasabi, maraming salamat po we still have a little over 1,100 attendees over in our Zoom, and I'm pretty sure in YouTube, also in the live streaming pages po of TVUP, Stop COVID Deaths, and the University of the Philippines. Magkita-kita po tayo ulit next week. Same time, same channel, Fridays, 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold